So we are doing in our hospital, our team is working a lot with optical coherence tomography, and now we are working with the optical coherence tomography angiography, so what we say OCT-angiography. So that is an advantage, because the angiography normally, when the ophthalmologists they are doing the angiography, you need to put contrast, and that is an invasive technique. With the OCT angiography, we can look at the optic nerve, we can look at the retina, but we don't need to put the contrast. So that is not an invasive technique, and it is very easy to do. So that now with the OCT, we were looking at the optic nerve, and we were looking at the different layers of the retina. And now with the OCT angiography, we are looking at the vessels, at the vascularization around the optic nerve. And that is important because we know in the multiple sclerosis, around the vessels, there are always a lot of inflammation and a lot of lymphocytes, so that we can look how is around the optic nerve. So that with this technique, we can see two different things. We can see the superficial capillary plexus and the deep capillary plexus. And in both of them, we can look the density of the vessels, and we can look the place without vessels. So that we have done our work, and we have two groups: patients with optic neuritis, so with an inflammation of the optic nerve, and patients without optic neuritis, without any inflammation of the optic nerve. We have compared, and we have seen that the patients with an optic nerve alteration, with optic neuritis, they have less capillary density. It means they have less vessels, because probably they have more inflammations and the vessels are probably destroyed. We don't know really the reasons. They have less density vessels, and they have a more area, the area of without vessels, that is getting bigger and bigger. So that it means, for one reason, we don't know why, the patients with optic neuritis, they lose vessels, and probably because they are losing because they have axonal damage and they are losing some cells. And on the other side, the patients without optic neuritis, they have a normal vessel density and they have a normal avascular area. So that I think that is important to differentiate patients that they have an optic neuritis in the past and others that they don't have, because sometimes the patients they cannot remember. And the other thing is important, we think that is important as biomarker of the prognostic, how will be these patients with the optic neuritis, and I think could be perhaps to monitor some new treatments as the BTK, or some new treatments that they can do reparation, that they can do remyelination, and we can monitor these treatments.